This is a WDIO News special report.
Good afternoon, I'm Bailey Warfield. We're coming on the air now because state officials are providing another update on their response to COVID-19. Minnesota Governor Tim Walz will speak in about a half hour, but first let's go live to Wisconsin Governor Tony Evers in Madison.
We know that cases continue to rise, will continue to rise over the next few weeks, especially with our expanded testing capacity. You might wonder if safer at home is working, but the science and the data tell us that staying at home is effective. So stay the course, Wisconsin. The more we all stay safer at home, the sooner we can get through the worst of this. We're saving lives by being safer at home. And now I'll get into today's update on Wisconsin's 24/7 Wisconsin state government response to COVID-19. State agencies, along with the Wisconsin National Guard and Wisconsin Emergency Management, are working around the clock to keep our communities safe. One of our most significant joint efforts has been the acquisition of personal protective equipment, or as we all know now, PPE, and additional testing supplies. I'll remind folks, our administration continues to work aggressively to acquire PPP through multiple channels, which includes FEMA and the Strategic National Stockpile, or SNS, procurement, donation, and through a buyback program. Wisconsin is competing not just with other states and competing with the federal government, but with the entire world to get these supplies. This is obviously a global crisis. I'll remind folks about our donation and buyback program that we launched last week. Wisconsinites can go to COVID-19 supplies, one word, .wi.gov/donations to either donate or sell large quantities of PPP to the state, such as masks, gloves, and gowns. The good news is that, due to the generosity of hundreds of Wisconsin businesses, nonprofits, and even individuals, we've been able to start distributing donated PPP to our local communities. But the bad news is we need much more. We need PPP and other supplies in order to increase our capacity to test tens of thousands of Wisconsinites, isolate and treat those who are infected, and do our best to contain the spread of the disease. Now, to be clear, we haven't been waiting to take action. We are aggressively pursuing any and every lead to buy these supplies. Many of our state's agencies are pitching in to assist the state emergency team with purchasing these supplies on our own. Our administration has also been working closely with other states to combine our purchasing powers to make larger bulk purchases, which are usually given priority. We are headed into the worst of this, folks, and the need is only going to get greater. That's why our leadership team at the State Operations Center has also been preparing to support our hospitals and our local and tribal health partners to assist them in setting up voluntary isolation centers. We're also working with the Army Corps of Engineers to ensure that field hospitals and facilities will be ready when the surge of acute cases begins to hit our healthcare systems in the coming weeks. Now, I trust science, our public health experts, our emergency management professionals, and our military leaders when they say these plans are necessary. I'm sure many of us would like to just wake up from this nightmare tomorrow morning and say it never happened. But the responsible thing to do is plan for the worst and hope for the best. So that's exactly what we're doing here in Wisconsin. We can and should learn lessons from other communities. Listen to the science, be prepared, act swiftly, and save lives. Now, in addition to the good work we are doing right now at the state level and in partnership with our local officials and the private sector, it's imperative that we move forward with further health and recovery efforts. The new federal law, called the Families First Coronavirus Response Act, is a great first step for our workers, businesses, families, and communities. This bipartisan effort to respond to the public health emergency that our nation faces is essential to ensure that we have the resources and flexibility to respond to our state and local needs. From the immediate health care and first responder needs to impacts to workers and businesses and our child care and educational systems, swift action is needed to respond to this public health emergency. Every day makes it more clear that a collaborative state and federal response must allow maximum flexibility for us to respond to emerging and urgent needs. Our state agencies have been hard at work, and we're learning more about the funds coming in from the federal government, including when we will receive these dollars and how they can be spent. Again, we hope for maximum flexibility in terms of meeting the needs of Wisconsinites across the state. However, even with these federal dollars, we will still need solutions at the state and local levels. Our state agencies have been hard at work to identify what's needed to ensure public health and safety in the near term and to aid our economic recovery in the weeks and months to come. Some of our most immediate needs include greater flexibilities within the Department of Health Services so that they can act rapidly and ensure folks are getting the care they need without any unnecessary barriers, such as pre-authorization requirements. Lives are on the line here, and we can't afford to be hamstrung by bureaucratic hurdles. We also know that other state agencies will need additional resources. One example of that is the Department of Workforce Development. Last week, more than 115,000 new preliminary unemployment insurance applications were filed with the DWD. That's 115,000 1 week. The UI call center also received more than 1.5 million calls in that same time period, which is an increase of 6,208% over their average weekly call volume. Just to underscore how significant the need is for these benefits, last Thursday, DWD received 400,000 calls between 6 and 10 a.m. At one time, they were averaging 160 calls per second. The system was not built to handle this call volume. However, we're working every day to increase that capacity. DWD has increased their phone capacity to allow 690 simultaneous calls. They've also expanded staff capacity at the DWD call center from 57 staff to 92 staff. But they're going to need even more help. DWD needs at least 80 additional staff to help triage calls for unemployment. And we need the legislature to take action to get rid of the 1 week waiting period before folks can start receiving benefits. Now, that's just one agency. We know that we will need more staff and more resources to support small businesses, to help our farmers, to expand healthcare capacity, and to keep our communities safe and strong. Now, I know that everyone shares my concerns about public health and safety and about the economic recovery. We look forward to working with stakeholders and our partners in the legislature to get things done as soon as possible. Thank you so much, and I'll now turn this over to DHS Secretary Andrea Palm.
Thanks, Governor, and thanks again to everyone for joining us today. So I'll start where I always do. Here are our numbers for today. 15,856 negative tests, 1,221 positive results, and we now have 14 deaths in the state of Wisconsin. The positive tests that's 109 more than we were at yesterday, and obviously that is an increase of one death over yesterday. That was of a male in his 40s. You can find these numbers as well as the county breakouts of this data on the DHS Outbreaks and Investigations webpage. Now I want to take you back to just about a month ago when Wisconsin had fewer than a handful of confirmed cases and our state lab had finally received the test kits they needed from CDC to begin running COVID-19 tests here in the state of Wisconsin. They were quickly joined by the Milwaukee Health Department and have ramped up over the past month to a combined throughput of about 500 tests per day. In addition, a network of labs across the state scaled up, averaging 1,500 tests per day. And while there is no backlog of tests, we have prioritized healthcare and long-term care workers, hospitalized patients, and those at risk of the most severe disease from COVID-19, while continuing to work to expand our testing capacity so we are in the best position to respond to this evolving pandemic. To that end, we stood up a strike team as part of our statewide response that includes additional labs and industry leaders in both the private and public sectors. Just like during H1N1, we knew that testing for this virus would require assets beyond the state lab. And for this response, that has taken the form of a strong partnership between government and some of the best and brightest minds in business and technology. Lucky for us that we didn't have to look very far to find them. Our lab capacity strike team has welcomed the expertise and insight of leaders from Epic Systems, the Wisconsin State Lab of Hygiene, and numerous other state agencies to share resources, equipment, and knowledge to remove barriers and enable us to add to this next layer of capacity, which, as we announced earlier today, will initially double our lab testing capacity. These additional partners, all Wisconsin-based, include Exact Sciences, Promega, UW Health, and Marshfield Clinic. These companies are pulling together and stepping up to provide operational and resource support to one another to bolster our state's testing capacity. But I want to be clear. Testing will still require a doctor's order, and these partners are not testing sites themselves. They will be receiving and processing the tests that are completed by healthcare providers. So while this is a critical step forward, it is important to remember something we have talked about a number of times before, that the supply chain for testing materials is extremely fragile due to this worldwide pandemic, much like the way the governor talked about the PPE challenges we're facing. So our new lab partners and our public labs will continue to be limited by access to the materials from their national suppliers and the federal government to complete these tests. And to that end, you remain a critical partner. We all need to continue to do our part to remain safer at home. Please continue your good hygiene practices. Continue to wash your hands often with soap and water. Cover your coughs and your sneezes. And when you leave home for your once-a-week grocery and pharmacy run, please exercise strict physical distancing. Stay at least 6 feet from each other. The more we all pull together while keeping our 6 feet physical distance, the better it is for all of us, and especially those on the front lines of our healthcare system, tending to our most severely ill friends and neighbors.
Thank you. We'll now open it to questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And for the sake of time, we'll also remind you that we are taking one question per reporter per outlet. So we'll begin the questioning today with Will Cushman from Wiscontext. Will?
Hi, thank you for the call. My question is for Secretary Designee Palm. You just mentioned that you hope that this new task force will initially double lab capacity, so would that equal about 3,000 tests per day, and will that be pretty much immediate? And what is your eventual goal for number of daily tests?
So yes, we do anticipate as a daily number that we will double what we've had previously, which is about 2,000 tests a day. I think all of our partners continue to try to expand their capacity, and new labs continue to try to come online. But as we have talked about, the rate limiting factor here, beyond bricks and mortar and equipment, is these reagents and ingredients that are necessary to run the tests. And so we all are very closely watching and working together to get our hands on the ingredients that we need to run these tests, but that ultimately really is what will limit our ability to continue to scale up. And so we'll keep you updated daily on our capacity.
Thank you, Will. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my question.
On Friday, DOA said that the state was nearing or in talks to purchase 10,000 ventilators. Can you guys provide any more detail on who that is being purchased from, what's involved with that kind of deal, and where it is on the timeline? Thank you.
So we have made a request to FEMA for ventilators out of the Strategic National Stockpile and continue to pursue private vendors to make purchases of ventilators. You know, we need to vet those companies. We need to make sure that they are legitimate and can supply what they say that they can deliver. And so we are actively pursuing a private sector vendor to place additional orders.
And just to be clear, this isn't the first time we've sought ventilators. We've been working with other states and trying to make a purchase. Those purchases fell through because we were competing with others. But I just have to make it very clear, we have been attempting to buy ventilators all along during this process. We believe we're at a point now where we will have some success.
Thank you, Sean. To Scott Bauer now from Associated Press. Scott?
Hi, thanks for this call. There's been a lot of talk at the federal level about a national peak hitting in about 2 weeks. Is there any estimate as to when Wisconsin cases are expected to hit their height, and how long after that high point do we expect the stay-at-home order to be loosened in some way?
Do you want to talk about the peak?
Sure. So there's been a wide range of modeling approaches, but from national and international groups, and they're all subject to the same limitations. Meaning we can predict how the virus acts under normal circumstances because we know how long it takes for someone to get infected. We know how well it spreads from person to person, and so a lot of the worst case scenario modeling are reflective of those parameters in the setting where people are interacting in as normal. So in those worst case scenario models, we're seeing the number of people infected double every 2 days. That was the early experience in Italy. That's unfortunately what we're starting to see in New York City, about a doubling time of 2 days. How long that really rapid exponential growth in the epidemic lasts is unclear, but it's really determined by how well we do social distancing and how we keep separation between people. So under the normal circumstances, the peak of about 2 weeks, with the largest number occurring there, is what most of the models say. Our hope, however, because the piece of the models that we have control over, meaning how well we keep separation between people, will actually cause a delay in the peak. So our goal is to stretch that out to the peak is lower so we get to the peak at a lower time and earlier, so the total number of people or the area under the curve is smallest. So we're operating under that assumption that it might be 2 weeks, but we're really trying to enforce our social distancing to make that peak as low as possible.
Thank you, Scott. Now to Micah Selner from the Appleton Post-Crescent. Micah?
Yeah, hi. So across the state, you know of any lower tier patients being tested and categorizing those results in your statewide numbers?
Michael, was the question, do we know of any lower tier tests?
Any lower tier patients who are currently being tested, and are you using those results in the statewide numbers?
So our prioritization remains in place, so we continue to test healthcare workers, those hospitalized, those on the front lines in long-term care facilities. So I don't think that we are...
Yeah, we're not declining to test anyone for whom a physician or a provider thinks is important to be tested.
Fair.
And so what we mean by prioritization is that the quickest turnaround time, if we have to do them in order, is for hospitalized, critically ill patients and healthcare workers. But of the 1,000 1,100 cases that we've had, actually a minority are hospitalized at the time of diagnosis. So plenty of cases are being diagnosed in people who have mild symptoms who come to urgent care or emergency department, and the healthcare provider orders a test. So we are prioritizing, but we're not restricting testing. Anyone who a clinician thinks needs a test can be tested within these parameters.
Thanks for that clarification.
Thank you, Micah. To Austin Montgomery from the Beloit Daily News. Austin? Beloit Daily News? Okay, we'll move on then to Sarah Thompson from WBAY in Green Bay. Sarah?
Good afternoon. I think this question would be for the governor. You mentioned in your opening remarks that we are headed into the worst of this, and mentioned about setting up voluntary isolation centers. Could you just elaborate a little bit more on what those would be, where they would be, and kind of what they would look like for people?
Andrea?
So we have been exploring setting up isolation facilities in a number of places around the state, as well as providing a toolkit and guidance to locals so they're able to establish their own isolation facilities when and if they need them. And the goal of these, as one of the priorities we have had throughout this response, is to ensure that there are safe places for folks who need to be isolated to reduce the spread of the disease, right? That is the point at which we are in this outbreak, is the physical distancing, the isolation necessary to stop the spread. And so what we've learned from our colleagues around the world and around the country is that an inability to have safe isolation places for folks minimizes your ability or reduces your ability to slow the spread. And so we are very actively working on a number of locations, and again, we'll be providing guidance to locals on how they can do that for themselves so that they regionally and locally have the capacity that they need to deal with this.
Thank you, Sarah. To Mark Leland from Fox 11 in Green Bay. Mark?
Hello. This might be going off this last question. I know, though, some state universities are working to potentially house COVID-19 patients. I was just wondering where that project was at, and do you anticipate having to use that for those sites anytime soon?
So I think so isolation facilities for folks who are experiencing symptoms and need to spend their time isolated away from others, separate from potentially needing additional bed capacity, surge capacity, both of which are priorities for us and that we are actively planning for and working through the SEOC to ensure with our healthcare hospital partners around the state that we are ready to do both of those things, and we are actively looking at potential sites and facilities to do both of those activities.
Thanks, Mark. Now to Rob Sussman from WTIQ Radio. Rob?
Hi, thanks for taking my question. My question is about community spread. It's been something that was talked about very early on in this thing, and it seems we're not saying the words community spread quite as much. I noticed that there is no longer a point on the website in which you can kind of track the counties in which community spread has been identified. My question is, why is that the case, and especially here in Brown County? We were said to have community spread, but our case numbers have been ticking up kind of slowly. Can someone speak to what's going on regarding community spread?
Yeah, I can address that question. So the cases that we have identified through testing are known to be a very small subset of the actual cases. We think it's safe to assume that all communities in Wisconsin, if they don't have community spread now, are at high risk of having community spread. And so it doesn't serve the public to have different activities. We feel like that because of the way that people travel between communities and the high proportion of people who can transmit the virus with minimal symptoms, the safest approach is to assume that it is in our communities. And I think that the data from other countries and around the country support the fact that it's likely here in all communities, since we're just testing a subset of symptomatic individuals.
Thank you, Rob. To Addie Bink from WFRB in Green Bay. Addie?
Hi, thanks for taking my question. I was just wondering if you could explain a little bit more about how DHS reports their case numbers. For example, we see counties individually confirming cases, and those numbers will sometimes be higher or just different from what DHS reports in the afternoon. So if you could just explain that a little bit.
Sure. So we are on a cadence of updating once daily as sort of the statewide source of truth about the state of our case counts. And our local public health departments and our labs are reporting that information into us on different cadences. And so we you know, at 12:30 we stop the clock, we count up what we've got, and we report it. And then as local public health feels the need to confirm additional things outside of that window, they do that, and then it will roll up for us into the next day's report. But we needed a way to be sure that we were on a daily basis updating the numbers and pushing them out in a way that people could know they were coming, could understand what they were, and then keep moving. And so we certainly would not discourage local public health from continuing to make information available as they feel that's important to do, but we roll that all up once a day and make it public at 2 o'clock.
Thank you, Addie. Now to John Nizer from NBC 26 in Green Bay. John?
Hi, good afternoon. Has there been any discussions with local paper companies here in Northeast Wisconsin about producing some PPE products that would make it so the state maybe doesn't have to compete with other states, but could then buy it off of local companies here?
I'll just mention that we're in the process of setting up a meeting, a virtual meeting with different paper companies. We're working through the Paper Council and to have that conversation. And it may be happening right now, but it's if it's not, it's in process.
Thank you, John. Now to David Wahlberg from the Wisconsin State Journal. David?
Yes, thank you. There was also quite a bit of talk yesterday nationally about the sort of worst case scenarios and better case scenarios in terms of cases and deaths. And last week, Secretary Palm, you provided an estimate, sort of a worst case scenario. If we didn't take strict measures in Wisconsin, we could have about 22,000 cases and 440 to 1,500 deaths by April 8th. I'm wondering, do you have any numbers based on models showing that we are taking strict measures? In other words, if we do things well, what might those numbers be April 8th and beyond?
Mm-hmm. So I do think, as we've discussed, from the time of infection till the time it shows up in our case counts, that there's a lag in that time, which is why we are continuing to see increases every day in our case counts, and I do think it'll be a couple of weeks before we start to really understand how well we all are doing social distancing, safer at home, to really judge ourselves against the worst case models. But you know, you can see our daily numbers as well as we can, but we really do believe that it's another 10 plus days before we are going to be able to start to see evidence of a flattening off of the new daily cases.
Thank you, David. Now to Parker Shore from the Cap Times. Parker? Parker Shore? A reminder, *6 to unmute your phones. Okay, we're going to move on to Matt Cash from WKOW-TV in Madison. Matt?
Hi.
That was a live news conference from Governor Tony Evers and other Wisconsin leaders on their response to COVID-19. Minnesota Governor Tim Walz is now giving his update via phone. Let's listen in live.
Let you know that we have lost another Minnesota neighbor, bringing the total to 10, 576 positive tests. I'll let Commissioner Malcolm go into a little more details, but just so listeners know and the press knows that I asked our team to go look at testing-wise and per capita-wise, we're near one of the tops of the states in doing that. And as we've said again, the testing and the source tracing still an important part of what we're doing, but it will come in to play later on. I want to also thank our students and teachers who are back at it today. I know that many are using the same technology across the country, and there's been some glitches in that, but we appreciate the ability to get that going. We knew this would take some working around, but I know that the teachers, the administrators, the support staff out there is totally committed to getting this right for our students. Appreciate after the first full weekend of our stay-at-home executive order, Minnesotans are doing this. Department of Public Safety indicated that over the month of March, it's not just this weekend, but over the month of March, overall traffic flow was down 71% in rural Minnesota, greater Minnesota, and 79% in the metro area. So Minnesotans are doing this. You're getting it right. We're grateful for that. And again, it falls into the strategy of slowing the transmission of COVID-19 while we stand up what we need. I wanted to just reiterate, and thanks again, this weekend I signed a comprehensive package around COVID-19 that the legislature passed. Great bipartisan work that they did, includes such things as establishing the Minnesota Fund to sprint further action so we can move swiftly, peacetime emergency child care grants, assistance for our veterans, supports food banks and homeless shelters, support for small businesses that Commissioner Grove will discuss in a little more detail, and extends disaster assistance to farmers. Also wanted to make note again as we approach the first of the month that Executive Order 2014 put a moratorium on evictions. Let folks know that I know this is a tough time. It's a tough time for those that are paying rent. It's a tough time for those who are landlords who have bills to pay too. I would ask folks to work with one another, try and figure out ways. If you're capable of paying, certainly do so. If you need to work out things with landlords or with Department of Human Services, please continue to let us know. So it's that spirit of working together, and I know this is a very challenging time. The stay-at-home order was pretty straightforward of what we're trying to do here. I've been saying every time we meet that the world's going to look a lot different next week, and one of the things I said several weeks ago was talking to my fellow governors, especially in states that are harder hit. It was a bit like talking to your future self, and they say the same things. It's about looking back. So I think as people are watching what's happening, we're trying to use those lessons learned to avoid some of the scenarios where we overrun our healthcare system. So I hope that you know the time that you're buying us. We're working round the clock, and one of the things we're doing is standing up operation work groups that have lanes of responsibilities. And just to give you an idea what some of those are is hospital surge capacity, alternative care facilities, healthcare workforce, creative partnerships, COVID-19 testing, at-risk populations, economic security, food security, education, child care. There's numerous lines. These will have state leads. These will have contacts in the State Emergency Operations Center, and they will have a public sector partner who's helping us with some of these things. And the one thing we want to talk a little bit about today is on critical care supply procurement and deployment, securing those critical needs for hospitals, emergency responders, traditional and non-traditional routes. That's the PPE and that's the ventilators. Managing statewide critical care supply inventories, of seeing the holistic healthcare system together, not as individual healthcare systems working on their own, but working together so that at any given time we can see inventories, we can see burn rates, we can see potential need, and we can make sure that we're using data and potential to move these supplies in a smart way, and then coming up with novel solutions, whether it's 3D printing or enlisting more people into that. I just got off a call over an hour with President Trump, Vice President Pence, Dr. Fauci, and my fellow governors. I think it was encouraging for us to hear the president's words over the weekend. He acknowledged that the seriousness of this. He extended what I think we spoke about last week was an unrealistic expectation that everything would be back to normal by Easter, and a refocused effort on trying to partner with the states to get these critical infrastructure to us. And one of the things is standing up this procurement. And we have Commissioner of Administration, Alice Roberts Davis, has a strong background in public-private partnerships, public sector procurement, private sector procurement. And I'd like to just turn it over to her to give a little bit of background on the work that's being done there. Commissioner Alice Roberts Davis.
Thank you, Governor. Good afternoon, everyone. I'm Alice Roberts Davis, Commissioner for the Department of Administration. I'm proud to be leading the Critical Care Supply Workstream. My number one goal is to make sure that Minnesota has the ability to resource the necessary supplies and equipment to respond to COVID-19. This is not a small task. Minnesota is in competition with 49 other states and many other countries as we work to respond to this global pandemic. But I think what's different is that Minnesota is incredibly fortunate to have a thriving corporate community that we're working with to fulfill these needs. From masks to ventilators, we have companies here at home that are ready and willing to step up and support our state, and we're very grateful for their partnership. We are working to understand the current usage of PPE by healthcare providers and creating models for projecting demand. But we're not sitting on our hands while that work is being done. We know there's an urgent need for masks and gloves and gowns and other personal protective equipment in our healthcare facilities today. So we're aggressively sourcing those items as quickly as possible. In addition, we are creating a short-term and long-term plan to first address the immediate needs, then how to use demand forecasting and automation to ensure that healthcare providers get the supplies that they need at the time that they need them. While this work won't be without its challenges, we will continue to use every public and private resource available to us to get the protective equipment to the frontline healthcare workers who are fighting to help keep Minnesotans safe from this virus. With that, I'll turn it over to Commissioner Malcolm from the Minnesota Department of Health.
Thank you very much, and good afternoon, everyone. I'm going to be a little briefer with some of the data today to leave more time for your questions. Globally, the total of cases around the world as of this morning was approaching 740,000 and 35,000 deaths. The U.S. in total is now over 143,000 confirmed cases, almost 60,000 in the state of New York alone, and just under 14,000 in New Jersey. The U.S. is now reporting over 2,500 deaths, 776 deaths in New York City alone, and that has been a meteoric rise in recent days. In Minnesota, as the governor said, we are now at a total of 576 laboratory confirmed cases in Minnesota, an increase of 73 from yesterday's total. And as the governor said, we were sorry to confirm our 10th COVID-19 death in Minnesota. The age range continues to be 4 months to 104 years. At the top, the median age is 45 years. Since the start of this outbreak, a total of 92 COVID-19 patients in Minnesota have been hospitalized. There are 56 patients currently in the hospital, 24 of those in intensive care. So that represents 17 more patients today than yesterday in hospital care, 8 more in intensive care, 9 more in medical, surgical, non-critical care beds. I also shared with you yesterday increasing numbers of cases or increasing numbers of facilities with cases in congregate care settings, specifically nursing homes, assisted living, memory care, and the like. We are now up to 31 of those facilities with at least 1 case. And I just want to remind you that we consider even 1 case in this congregate care setting to trigger an escalated response. So we are counting as a quote-unquote outbreak any facility with even 1 case and are standing up a very vigorous response in close coordination with those facilities, as you've heard previously. And as we keep reminding, this total of 576 lab-confirmed cases is just that, only the results from laboratory testing. We know that there are more cases in Minnesota and that the virus is circulating widely in our state, and that we should assume it is circulating in all communities and act accordingly to really, really follow the health guidance about isolation and quarantine, and to follow the community mitigation and social distancing strategies. And as the weather improves, we're all itching to get outside, but please remember that it's important to maintain social distancing even when outside. I think I will not, I'll just mention really quickly the laboratory testing. I think we've mentioned before the number of lab tests tend to be lower over the weekend as a result of fewer tests coming in from the provider sector. So we had just a little over 1,100 samples tested yesterday between the state public health lab and our external labs. I just do want to note that as of now, we have no backlog in the lab testing. And I think I will leave it there. I won't repeat for you the public hotline numbers, but we certainly can get them to you if you would like them again. And with that, I'll turn it to Director Joe Kelly at the State Emergency Operations Center.
Thank you, Commissioner, and good afternoon, everyone. On behalf of my boss at the Department of Public Safety, Commissioner John Harrington, I extend a heartfelt thanks for the overall excellent compliance with the governor's stay-at-home order. Almost all Minnesotans are following the order, and we thank you. Staying at home, that's one of the key ways of limiting the spread of the virus. Local law enforcement is approaching any suspected violations with information and education, telling folks to move along and comply with the order. As the governor has said many times before, law enforcement is not looking to issue citations or charge people, and I'm confident we'll all do the right thing. Issues with the stay-at-home order are best handled at the local level, but that said, if you would like to report a concern about compliance that you haven't been able to resolve locally, please call 651-793-3746. That's 651-793-3746. You can also send an email to SAH violations, that's all one word, at state.mn.us. The SAH stands for stay at home, so that's SAH violations, all one word, at state.mn.us. Personal protective equipment, commonly referred to as PPE, continues to be a challenge, and PPE includes masks, face shields, gloves, gowns, hand sanitizer, and similar items. As we gather up as much of that stuff as we can, we're grateful for the Salvation Army and their partnership. They're willing to take donations of PPE at their sites in Roseville, Duluth, Moorhead, and Rochester, and they're hoping to expand a couple more sites around the state this week. But you can also donate PPE through your local emergency manager, and we'll get it to the warehouse for distribution to our healthcare workers, first responders, and others. Those items are badly needed, and every little bit helps. The alternate care site planning team continues to work on identifying facilities around the state we could potentially use as temporary hospitals for non-critical patients. Since that process started late last week, our team has assessed 5 sites, and they've confirmed 3 of those that could work and accommodate up to almost 500 beds. The team is in southwest Minnesota today looking at 2 more sites. Their immediate goal is to identify space for 2,750 beds, 1,000 in the metro and 1,750 in greater Minnesota. And that's on top of the additional capacity our hospitals are generating on site. We're not ready to identify what sites we're considering for these additional facilities yet because the team is early in the process. And at this point, we're just not sure where they're going to end up. Over the weekend, the news media again reported on our blood banks being low in supply. In fact, I heard a spot on the radio about that during my drive in this morning. The blood banks have a by-appointment system for donors so you can safely give blood while maintaining social distance. We need you to give your time as a volunteer, a charitable cash donation, or a pint of blood to help care for our fellow Minnesotans. Beating this virus is a team sport, and we need you on the team. I now turn to Commissioner Steve Grove of the Department of Employment and Economic Development. Commissioner?
Thank you, Director Kelly, and good afternoon, everyone. As we begin our first work week of the governor's stay-at-home order, we continue to provide clarification and guidances to businesses across the state on how to manage this period of time. We've responded to about 2,500 businesses seeking clarification on the order thus far. The team is manning that form at mn.gov/deed/critical, there to provide guidance for any business who needs it. We've also published a 13-page document that goes into more detail based on the incoming questions that we've gotten to provide further clarity for businesses in Minnesota. But, you know, as Director Kelly said, we just want to emphasize we're relying on Minnesotans to use good common sense, their commitment to the greater good here. That's the goal of stay-at-home is. Don't go to work unless you're in a critical job and you can't perform your duties from home. I want to give an update on the unemployment insurance program. We have thus far, as of last night, received 239,263 new applications since March 16th. That means in the past few weeks, we've had more applications in this period of time than we got in all of 2019. And so to accommodate that huge increase in applications, we are moving to a new system to intake new applications to unemployment insurance that I want to walk through today. it's based on ensuring that people can get excellent service and efficient service quickly on our UIMN.org platform. So the way it works is if the last digit of your social security number is 0, 1, or 2, we ask that you apply on Monday. If the last digit of your social security number is 3, 4, or 5, you should apply on Tuesday. And if the last digit of your social security number is 6, 7, 8, or 9, you should apply on Wednesday. And we'll leave Thursday and Friday open for anybody who missed their assigned day. But this is just going to allow us to provide faster, more effective service. So far today, it's already working really well. We're able to get to people more quickly. And I just want to make sure Minnesotans know that this does not affect the amount of benefits you're going to be paid. If you're already signed up for unemployment insurance, you can still log into your account at any time. And there's really no need to call the unemployment insurance staff to check in more deeply about this. We're asking people to use that online interface at uimn.org, and there's a need-to-know page there with all kinds of answers to frequently asked questions. We thank Minnesotans for bearing with us as we try to provide the best service possible at an extraordinary time of use of this program, and so far so good. We appreciate people following this new guidance, and we'll continue to roll it out in the coming days. As many of you have seen, the federal stimulus bill, or CARES Act, does include additional programmatic adds to the unemployment insurance program. Most notably, there's additional benefits that will come through this act that will kind of top off people's benefits by $600 more per week through July 31st, 2020. In addition, the federal government has passed benefits for self-employed individuals or independent contractors, those who don't usually qualify for unemployment insurance benefits. We are still waiting on some guidance from the federal government in terms of calculating wage rates so we can pay out those benefits, but this is great news for independent contractors and self-employed individuals who would not usually be covered by this federal program. And then lastly, the federal government has extended unemployment insurance benefits by 13 weeks through December 31st, 2020. And the goal there is, if you've already run out of your unemployment insurance benefits before this crisis hit, you now will have additional benefits to get you through this difficult time. And so we're continuing to work very closely with the Department of Labor, along with all other 50 states, on implementing these new benefits, and we'll have more guidance soon for Minnesota workers as those roll out. Of course, while many people are finding themselves temporarily sidelined from work, there are lots of companies that are hiring, and we continue to see job postings come up on our National Labor Exchange and on our website at DEED, and the top occupations continue to be the ones you might expect: nursing assistants, human and social services assistants, registered nurses, customer service representatives, security guards, and personal care aides. Just for example, Minnesota with disabilities, need more reliable care now than ever before, and ARRM is hiring on their job board 18,500 direct support workers in Minnesota. So we encourage Minnesotans who are looking for work to look at companies that are hiring at increased rates at this time. The top 7 employers who are hiring in Minnesota right now are Allina Health, Fairview Health, Securitas Security Services, Wells Fargo, Randstad, which is a staffing agency, Walgreens, and Thomas Allen Personal Care Aides. So we'll continue to push that information out, and want to ensure that where there is opportunity for Minnesotans today, they can take advantage of it, and we can staff up these critical industries and companies as they respond to the COVID-19 pandemic. The governor mentioned a moment ago some new developments in our small business emergency loan programs. We are launched today officially our emergency loan program that the governor signed into effect with Executive Order 2015. This specifically targets businesses that were affected by Executive Orders 2004 and 08. So restaurants, bars, places of public amusement. That loan program is officially, as of today, open. The way that it works is we leverage lenders across Minnesota to issue these loans to their communities through money that DEED encumbers to them. Loans are 50% forgivable at 0% interest rates. You can take out anywhere between $2,500 and $35,000. And the lenders we work with are very diverse, both in terms of the groups that they target and the geographies they target. So we think this will be one of the more equitable small business emergency loan programs in the country. It's our goal to make sure all of those lenders have the funding that they need, and that within 24 hours of receiving those applications at DEED, we can turn around that funding and get that money out quickly, which is really the whole point of this, to provide fast assistance to small businesses when they need it most. And then the governor's signing of the legislation over the weekend, in collaboration with the legislature, puts into effect another lever, which is a small business loan guarantee program. And the idea here is, how do we leverage more money from the private sector? How do we get more banks to opened up to loaning money to distressed small businesses at a time when so many are facing challenges. This program gives a loan guarantee to those applicants of up to 80% of the loan amount. We have $10 million set aside for this program, which should leverage $20 to $25 million in additional private capital in the market for small businesses. So we are, as of today, actively seeking lenders throughout the state that want to sign up as partners in this effort. Please go to mn.gov/deed to find out more about how to become a bank that works with our network here. We want to leverage every possible dollar we can get from the Minnesota market for our small businesses that are facing challenges today. And lastly, we continue to track just amazing stories from businesses across the state that are doing great things, really all on their own in a time of crisis. The one that caught my eye most recently that was really interesting to see was a Worthington-based twist tie manufacturer called Bedford Industries that was watching some videos of hospital employees really struggling to construct face masks and face shields out of office supplies, and they said, hey, I think we could do that. And so they retooled their assembly line immediately, and they've already manufactured 100,000 face shields a day to protect healthcare workers. It's a twist tie manufacturer that suddenly has become a face shield factory to help workers both in Minnesota and across the country. So our businesses continue to lead with a great Minnesota spirit, doing amazing things for our economy and for our healthcare system at a time of great crisis, and we're so grateful for that. With that, I will turn it over to the Deputy Commissioner of the Department of Education, Heather Mueller.
Thank you, Commissioner Grove. Today, as you know, it's a big day for education in Minnesota. The Governor's Executive Order 2019 begins with day one of distance learning. That means that after the 8 days of planning that our schools have been doing and our leaders and educators have been doing, that we have moved into the implementation phase. And we are recognizing that we are all in this together, and as we've moved into distance learning, it is really about ensuring that we are maintaining the continuity of learning for our students as well as the teaching for our educators, and that they're receiving this education in a really safe and welcoming environment in which they deserve. And when we think about this distance learning, it is the reminder that although the academics is at the core, there is nothing different about the education they're receiving beyond the environment in which they're receiving it. The relationship between the educator, the family, and their communities really continues to maintain that student-centered focus, and that does not change in this environment. It just means that where they're doing it looks a little bit different. And so we're asking for patience from our educators, our families, and our students as we learn in this new way for the very first time. These are environments, learning environments and instructional models that we have not necessarily used at a large scale before. And we recognize that there are going to be moments when we could do better, and then we will do better. And then there are times when we are going to find successes that we never knew we were going to have. So on that, I'd like to thank our educators and our school staff for stepping forward to meet this moment. While they are completely changing the way that they do their work and in their environment, they continue to do their jobs with a high level of integrity, and their ingenuity and creativity in this time has been remarkable. And so with that, I'd like to pass it back for the Governor.
At this time, Teddy's going to open it up for questions. I'd just like to, again, thank all the commissioners for their work, our public-private partners, and just the data that we're getting to move forward with our plan is amazing. And a special thanks to the Minnesota Hospital Association, working in partnership with the state, that I can open up a document and I can see all of the 8 regions across the state. I can see in-use beds, available beds, in-use ventilators, available ventilators, almost in real moving time. And that's the type of data, the type of collaboration that's going to keep Minnesotans safe and reduce the number of fatalities. With that, Teddy, we're open for questions.
That was an update from Governor Tim Walz and other Minnesota leaders on their response to the COVID-19 pandemic. We will continue to track developments this afternoon and bring you updates as they happen on the WDIO website and mobile app, and we'll bring you the latest on WDIO News at 5. Thank you for joining us.
This has been a WDIO News Special Report.